Walter Miller is internationally recognized as a pioneer in gene cloning and the identification of steroid hormone gene mutations that cause human disease. He embraced the new science of biotechnology in its infancy and became the first person to clone bovine growth hormone and the gene that causes vitamin D-dependent rickets.
I started off as a grade school child, as a science nerd. I always liked chemistry. I was one of those kids who was blowing up his garage when he was in junior high.
I think of Walt as the quintessential physician investigator. If he had not had been firmly based both in medicine as well as basic science, he could have gone off track.
In fact, Dr. Miller did go off track early on when he earned his bachelor's degree from MIT in literature and philosophy.
I think the philosophy and ethics, how one varies from the other, is a good question.
Dr. Miller says Duke inspired him to turn the corner for good in favor of medicine.
When I was at Duke, because of the new curriculum, I was able to take my third year and do graduate school courses in the Department of Biochemistry. And so Duke helped me go back to what it was that I really am, which is a science nerd.
He points to a particular Duke class that changed the course of his life for good.
One of the most exciting experiences of my life was taking the macromolecules course that Drs. Tanford and Hill taught. They made the physical chemistry of macromolecules come alive. It was really fun.
Dr. Miller's medical school class was the first to go through Duke's new innovative curriculum, in which 2 years of basic sciences are combined in year one. Students spend time on the wards their second year, and their third year is dedicated to research or earning a second degree.
Well, I always like to say back then that we were the experimental group, but there wasn't a control group. In retrospect, we were probably the out-of-control group.
I'm not sure what our deans envision would actually happen when the new curriculum was started at Duke, when I was a third-year student and he was a first-year student. But certainly whatever they anticipated, Walt made everybody look good.
I think Duke's new curriculum, and especially the experiences that I had in that third year, have had a dramatic impact on my subsequent scientific career.
After graduating from Duke University School of Medicine, Dr. Miller performed 2 years of pediatric residency at Mass General Hospital, then 2 years doing research at the National Institutes of Health. In 1974, he went to the University of California, San Francisco to finish his pediatrics residency and never left.
Back then, in the late 70s, cloning was a black art. There were no cookbooks, there were no lab manuals about how to do it.
In 1979, when he was the first to clone bovine growth hormone, he knew he had done something of great significance.
When I pulled the autoradiogram out of the tank and looked at it against the red light, I could see the two bands showing that I had my growth hormone cDNA clone, and I let out a silent scream of joy.
He would be an absolutely terrible poker player, I think. He's really pretty easy to read.
Dr. Miller is married to Dr. Cynthia Mellon, a professor of obstetrics and gynecology and reproductive sciences, also at UCSF. They have 2 children, Samantha and Nathaniel.
The woman I married was a PhD in biochemistry who was a lot smarter than I am and has helped me at every stage of my career.
Clearly, he's among the most deserving. I think he's also a credit to the new curriculum at Duke.